Hi, I'm Dr. Sam Wee of Tulique Clinic in PJ, Malaysia. Basically, AAAM gave me a very comprehensive and also a detailed course on how to go along and the way that we can manage our day-to-day business as in clinical practice, and also there's a guideline of protocols where we can help us to manage our patient more efficiently. And also aesthetic medicine is a new branch in medicine where AAAM gave us a guideline so that we can manage our patient expectation better, as we know that aesthetics patient is a new breed of patient. What I enjoy the most in AAAM is that I'm able to expose to a more internationally renowned speakers and get to know them more personally and get to ask them questions that has been bothering us in our daily practices. And part 2 does give a more comprehensive and more guided teaching into how we can manage our patient more efficiently. Definitely, I would recommend this course to my friend because sharing is caring. No matter how good or how bad is something that we should always share to people. Whether is it good or bad is on your own judgment, but this course definitely benefits in all different levels, and it also helps you to give you a credential on the certification levels, because this is a new branch of medicine. Everything is is new, and it is a good thing that we can talk to a lot of people regarding how we can manage our patient on day-to-day basis, and the new thing. So it's good to talk around and know more people, and at the same time networking. So yes, definitely I would introduce this course to my peers and perhaps my juniors too.